The Trump administration has announced a major overhaul of federal nutrition policy, unveiling new dietary guidelines that officials say represent the most significant reset of U.S. food standards in decades. The 2025 to 2030 Dietary Guidelines for Americans were released during a White House briefing featuring top health, agriculture, and medical officials. The administration says the updated guidelines are designed to combat rising rates of obesity, diabetes, and other chronic diseases, while also addressing soaring healthcare costs across the country. Federal dietary guidelines play a powerful role in shaping what Americans eat. They influence school lunches, military meals, veterans' hospitals, food assistance programs, and federal nutrition education used nationwide. Administration officials argue that previous guidelines failed the public by promoting highly processed foods, refined carbohydrates, and low-fat diets that contributed to worsening health outcomes. They say the new framework is built on what they describe as gold standard science, common sense, and a renewed focus on whole, nutrient-dense foods. The Dietary Guidelines for Americans were first introduced in 1980 and are updated every 5 years. Over time, they became the foundation of nearly every federal food and nutrition program in the United States. For decades, federal policy emphasized reducing fat intake, particularly saturated fat, while encouraging high carbohydrate consumption. During the same period, food manufacturers increasingly turned to refined grains, added sugars, and ultra-processed foods. As these foods became cheaper and more widely available, rates of obesity, type 2 diabetes, heart disease, and metabolic disorders steadily increased. According to federal data, the United States now has one of the highest obesity rates in the developed world. Childhood obesity has increased dramatically over the past 4 decades, with millions of children now living with chronic health conditions once seen primarily in adults. Health officials say these trends coincided with dietary advice that discouraged protein and fat while failing to account for the long-term effects of ultra-processed foods. Administration leaders argue that past guidelines were shaped in part by corporate interests and outdated research models, leading to recommendations that did not reflect real-world health outcomes. According to the administration, poor diet is now one of the leading drivers of healthcare spending in the United States. Federal health data shows that nearly 90% of healthcare spending is directed toward treating chronic disease. Obesity alone accounts for hundreds of billions of dollars in medical costs each year. Officials point to rising rates of diabetes, cardiovascular disease, fatty liver disease, and insulin resistance, conditions increasingly diagnosed in children and young adults. They also note that more than 3/4 of military-aged Americans are currently ineligible for military service due to health conditions, many of them linked to diet and obesity. Administration officials argue that the U.S. healthcare system has focused too heavily on pharmaceutical treatment rather than prevention, leading to higher costs and poorer outcomes. The new dietary guidelines are presented as part of a broader shift toward prevention-focused health policy. The updated dietary guidelines introduce several key changes. First, they place a stronger emphasis on whole, nutrient-dense foods, including higher protein intake, healthy fats, fruits and vegetables, whole grains, dairy products. Officials say protein recommendations, particularly for children, have been significantly increased compared to prior guidelines. The new framework also moves away from decades of messaging that warned against saturated fats. While limits remain in place, officials say the guidelines no longer treat saturated fat as a primary dietary enemy. Instead, the focus shifts toward reducing added sugars and ultra-processed foods, which are identified as major contributors to metabolic disease. Sugar-sweetened beverages receive particular attention, with officials calling them one of the largest sources of added sugar in the American diet. For the first time, the guidelines explicitly address ultra-processed foods, warning that diets high in these products are associated with poorer health outcomes. Officials summarize the new guidance with a simple message: eat real food. Although the guidelines themselves are not mandates, they directly influence how food is purchased, prepared, and served across federal programs. This includes school lunches for more than 45 million children each day, meals served to active duty service members, food provided in veterans hospitals, and nutrition programs such as WIC, Head Start, and SNAP. Administration officials say implementation will begin with updates to procurement standards, menu planning, and nutrition requirements across agencies. School lunches are expected to be a major focus, particularly in lower-income communities where school meals may be the most consistent source of nutrition for children. Officials say the goal is to increase access to protein-rich, nutrient-dense foods while reducing reliance on ultra-processed products. They also note that changes will be phased in over time, with agencies working to align rules and contracts with the new guidelines. One concern frequently raised in discussions about healthier diets is cost. Administration officials argue that eating healthy is not only achievable, but often less expensive than diets dominated by processed foods, when long-term health costs are considered. They acknowledge, however, that access remains a challenge in areas known as food deserts, where grocery stores offering fresh foods are limited. To address this, the administration points to upcoming changes in SNAP retailer stocking standards, which would require participating stores to carry a wider range of staple and nutrient-dense foods. Officials say these changes are designed to ensure healthier options are available even in underserved communities. They also argue that the perceived low cost of processed food is misleading, as the true cost is paid later through healthcare expenses and lost productivity. Administration officials estimate that reducing diet-related chronic disease could save hundreds of billions of dollars annually in healthcare spending. They point to data showing that even modest reductions in obesity rates could result in tens of billions of dollars in savings for Medicare and Medicaid. Beyond healthcare, officials argue that better nutrition could improve workforce productivity, reduce disability, and extend working years, boosting overall economic output. They frame the new dietary guidelines as not just a health initiative, but an economic and national security strategy. The Trump administration describes the release of the 2025 to 2030 Dietary Guidelines for Americans as the beginning of a long-term transformation of U.S. nutrition policy. Officials say implementation will continue across federal agencies in the months ahead, with updates to school meals, food assistance programs, and nutrition education. Supporters argue the changes restore scientific integrity and common sense to federal health guidance, while critics are expected to closely examine how the guidelines are implemented at the state and local level. For now, the administration's message remains consistent. America's health crisis is driven by diet, and changing what people eat is central to changing the nation's future.